with our monthly coalition meeting. Actually, this is our quarterly meeting. Welcome to March. If I could bottle time up and sell it, I'd be a trillionaire, I guess. But we are one quarter into the new year, so. Here's our agenda for today. Looks like we have about 38 folks on the call. We'll try to breeze through this fairly quick. Don't have a ton of updates this month, but we will have a presentation at the end of this. So I'm encouraging folks to stick around through the end as we'll have a presentation from the folks at GER. Regarding a software product that we are looking at for potentially ACS operations. So just double checking. Okay. Yep. Kobe's going to be jumping on here shortly. So let's go ahead and do a quick roll call of the folks we got on. We'll start with our hospitals, starting with Anderson Hospital.
Eric is here from Anderson and Community Hospital Steubenville.
Thank you, Eric. How about Alton Memorial?
Good morning, Phil. This is Aaron from Alton Memorial Hospital.
Thanks, Aaron. Boyd. Nancy's not on today. How about Carlinville Area Hospital?
Tyler's here from Carlinville.
Thank you, Tyler. Fayette.
This is Tina and I'm here.
Hello, Tina. Gateway. Right, no one from Gateway on right now. How about our HSHS partners? Starting with Holy Family.
Cindy from Holy Families here.
Thank you, Cindy. St. E's.
Brad from St. Elizabeth's Hospitals here.
Thank you, Brad. How about Breeze? And Highland? No Breeze or Highland today. How about Jersey Community Hospital? From Memorial Hospital Belleville, you obviously got myself, Scott Klosterman. Lee is on his way back from our OR where we had our spill at, so he should be joining here shortly. And soon, coming, hopefully starting next week, we will have Sean Eisenhower, who has filled our position over at Shiloh. So not sure if he's on today. I know he's getting ready and getting prepared for his transition. How about Memorial Hospital Chester?
Good morning, this is Georgia.
Thank you, Georgia. OSF St. Anthony's.
Hi, Phil,
Tracy
this
from
is Jenny.
OSF is here.
Okay, we got Tracy and
Jenny.
who else? I'm sorry, who was
Jenny
that?
Stanford's here, Phil.
Okay, gotcha, Danny. Thank you very much. Redbud.
Tara's here from Redbud.
All right, Tara, let's go down to Sparta.
You got Dan and Dale here today, Phil.
Rescue Rangers. That's what I'm gonna call you guys now. Perfect. Dan and Dale. Thank you so much. And down to Touche. More from Touche on.
Hey, Phil, this is Aaron.
Uh-huh.
And Alton. There's a note in the chat. Scott Wiseman from the Rehabilitation Institute of Southern Illinois. He's on. He says he's not on your roll call list.
Oh, okay, got it. All right, let's go over to our health departments. Starting with Bond County.
Wendy's here with Bond County Health.
All right, awesome. Calhoun County. How about Clinton County?
Hey, good morning. This is Brett.
Thank you so much, Brett. Eastside Health District. Fayette County. Greene County. Jersey County. And for Macoupin County, I know Derek is here. I see him in the chat. He's listening on. He's double meeting it. I know what that's like. Okay. Monroe County.
Vicky here.
Thank you, Vicky. Randolph County.
Deborah Grapperhouse is here for Randolph County.
Thanks, appreciate it. And St. Clair County.
Good morning, Bridget Farango here with St. Clair County.
Thank you, Bridget. Over to some of our community partners. I know we will not have our RMSC on today. How about Beth, our ERC, our Emergency Response Coordinator? Are you on this morning?
Good morning, Phil. I'm here.
Thank you so much. Any of our BJC partners on this morning?
Good morning, Phil. Sean's here.
Awesome. Thank you, Sean. We got Sean on. Anyone else? Any of our other BJC partners? Michelle, Jason? Okay. Our EMAs out there. Which EMAs do we got on? Michelle, I see you. You and Jacob. Oh, I'm sorry. Who was that?
It's Sam from EMA.
Hey, Sam. Good morning. Thank you so much. And I do see Michelle and Jacob over there from Madison County Health Department. Thank you. Any other EMAs
So
on
this
this
is
morning?
Heidi Carter.
Okay, Heidi. Gotcha. Thank you.
Phil, this is Keith Norman from Jersey County EMA.
Thank you, Keith. I appreciate your attendance today. Any other EMAs on? All right. Our other community partners, MedStar. Anyone from MedStar on this morning?
Good morning, Phil. You got John Nowak here, MedStar.
Awesome. Thank you, John. Anyone from Abbott today? Nope. Okay. How about SLU?
Good morning, Helen Sankool from SLU.
Good morning, Helen. Thank you so much for joining. I see Johnny Mack there from Scott Air Force Base Clinic. Hua, thank you for joining. Any of our STARS partners?
Hey, good morning. This
Brian?
is Sam. Brian's also on, so Sam and Brian are both here.
Awesome. Thank you so much, Sam and Brian, for attending today. And anyone from representing the St. Louis Regional Healthcare Coalition.
Morning, Phil. This is Nick Holberg.
Awesome, Nick. Thank you so much. If by chance you didn't get called out, please just dump your information in the chat, and just so we can make sure that you get accounted for. I do a download of the attendance roster as well, but just want to make sure that you guys get accounted for. And just a quick other administrative note, this is being recorded and will be uploaded to our YouTube page later. Unfortunately, last month's call, for whatever reason, did not get recorded, so it is not up on our YouTube page. Not sure exactly what happened. I like to try to make sure that those are out there for posterity, but also for your guys' review as well. So both audit purposes and just so you guys have action. And sometimes we got to go back and say, hey, what did we say during that meeting? So we can take a look back. So apologies there. Again, not sure if it was a Teams issue, but it just didn't get recorded. I do see a few other folks in the chat. Eric at the VA, thank you. And Carla over at Monroe County, thank you so much. All right. This is good. No open due outs to anybody. So hopefully if you've asked for or requested information or need that you have out there from our last meeting, that we've taken care of that. Starting off from an IDPH perspective, I don't have any specific updates with regard to IDPH, but I will use this opportunity to talk just a little bit about the upcoming NOFO or budget period or grant period. It's the notice of funding opportunity has not been fully released yet. So when it comes to what the specialties are for the next 5 budget periods, we don't know what those are. When I say specialties, what is the kind of targeted capability of that year with regard to all HPP programs and coalitions? So I don't know what that's going to be yet. So hopefully we'll get an update this month or next month. And once we do, we'll be able to share that, and then that'll continue to help shape our integrated preparedness plan. We've talked about those mission goals, et cetera, for the last 3-4 months now. And we just need that to kind of finalize this next 5-year budget period. So hopefully we will have some updates there. I'll pause here. Well, I'm going to switch it over to Beth for public health departments. But Beth, if you have any updates from IDPH, please feel free to let them know. So Beth, what updates do you have?
Sure, thanks, Phil. The big thing that we've been working on, which does not affect this whole region, but it does affect Southern Illinois, is the eclipse. So we've been having meetings and exercises, and there will be a presser on Friday that will be live streamed if anyone's interested in watching that. It's coming up quicker than we think. I just had a call with the PIOs, and I know some of you guys were on it. The only thing I wanted to mention, and since there are hospitals on this call, is we were putting out messaging a lot about how to safely watch the eclipse. And we all went through this back 7 years ago. Some of us did. And the safety eclipse glasses have to be approved by ISO. That's pretty easy to check, except as we are in America, the last time there were some last minute providers who started selling glasses, and they printed the ISO certification, but they were not ISO certified. So I just kind of want to make people aware of that. We're getting ready to pull something together with some of that information. What the people have come up with as a solution, and this is what we did last time too, that worked pretty well, is just provide a list of providers of these eclipse glasses that do sell the approved glasses. So the key takeaway is don't rely on the ISO printing on the glasses, but instead go back to who manufactured the glasses. Again, hopefully we won't have a big run at the ERs next month after the eclipse. We have set up some Essence boards so that we can watch for that. Last time, I think we had a couple of cases of people who went into the ER with eye issues. So again, that's just kind of the message that I wanted to make sure got out there for you guys. As far as the NOFO, the public health FEP and CRI NOFO has been released. It's been out a couple weeks now. It's a lot different than what we are used to. And again, we have talked about this at some of the local health department meetings. I didn't see much about the hospitals. It's going to be hard to coordinate until we know what your HPP NOFO looks like. But it's a lot more performance-based. In addition to the traditional 15 public health capabilities, they have added 10 response capabilities for public health. So those will need to be looked at too. As far as exercises, a lot of it is performance-based. They want to start with a risk assessment, and then, shoot, I can't find it in my notes here. But there are a couple of deadlines for the end of the year, and then one for June of next year, having to do with the exercise. Oh, here it is. Risk assessment by January 31st of 25. IPPW and multi-year IPP is due by June 30th of 25. Again, as usual, we're glad to see it, where a lot of us are going through it carefully. I think it's 108 pages. And hopefully the HPP will be up so that we can coordinate our efforts on that. That's all I had, Phil, unless anyone has any questions.
Any questions for Beth? And you're absolutely right. The hopefully, we'll get ours soon so we can make sure and see where the alignments and maybe misalignments are between both. One of the common themes I will say, again, that was provided to us in November from ASPR was that it would be more performance-based and allow us a little more flexibility and less prescriptive. And I challenged the director to make it less than 100 pages. So she said, yeah, we'll try. So we'll see what happens, and hopefully it'll be easy to merge. Again, any questions for Beth? Okay, hearing none. Thanks, Beth. We'll move on to our folks over at STARS. STARS, any updates?
I'm not sure if Sam's on. I thought she was. I can update a couple of things real quick while we see if Sam's available. We've got some quite a few exercises coming up in June. We have the MRSE exercise over here. That is June 27th, I believe. And in July, we have the dense urban terrain, also sometimes referred to as the Task Force 46 exercise. That's a large scale, I'm sure you've heard about a little bit at least, where the U.S. Army and other federal entities are coming into town. And we're doing some full scale and a number of other events. USAR's involved in it, hazmat, hospitals, etc. But those dates look to be July 14th, which is a Sunday. They've got some activity then through, I believe, Thursday, July 18th. Those are the big events I'm aware of. And we might want to follow up again with Sam in a little bit. Thank you.
No, thank you, Brian, for the update. So yeah, if Sam is on, feel free to jump in if you can't jump in right now, but if you don't have anything else, we'll just move forward. Okay. How about the St. Louis Coalition? Nick, any updates?
Hey, good morning, everybody. Thanks for having me as always. Mainly just a couple things. We adopted our strategic plan a couple weeks ago at our last meeting in February, so we're excited about that. Happy to share that if anybody would like to see it, but basically we're setting some priorities for the next couple of years around membership, training, exercise, budget, seeking potentially other funding sources that might be out there over time, and making sure that the coalition is strong administratively. So we'll get going on that, ideally starting with some goals July 1st, aligned to the new HPP work plan when we see that. Brian mentioned our MRSE exercise. We're in the middle of planning that. And that is confirmed for June 27th. That's going to be a seismic event with a tabletop leading into the dense urban terrain exercise that Brian also mentioned. And otherwise, just trying to finish up some goals here for this fiscal year, heading into the next couple months, and trying to pull in some new partners as usual. So I believe that's end of report unless there's any questions.
Nick, and is that for your Mercy? You're finalizing, that's for fiscal year 25. We're finalizing the BP5 period. Is that what you're doing that one for?
Yes. Yeah. And
Okay.
then there was some talk originally about us possibly trying to knock out, I guess it was, so June 27th will be FY24. And then there was some talk about us trying to use the dense urban terrain for some surge components to meet our FY25 needs. But I think that has been scrapped as the exercise has kind of morphed outside of that a little bit.
Makes sense. Well, thanks for that update. And just as a cursory note, last year we did our Mercy exercise. We front loaded that onto I think we did it in July. We're going to probably be targeting July again as well for ours, so we can get that out of the way. Although it may shift to August if the NOFO, is later. So we just don't know if it's going to have that in there. We presume it will be a part of the next budget period, but it might not be. So it may shift to August at the latest, but we'll be front loading ours again this year. Okay. All right, Mike, any updates for Reamer?
just that we're planning training during the eclipse to pre-stage us closer towards where the population is going to be accumulating. We're going to be doing some meeting up with Beth and kind of doing a face-to-face for our administrative or for our leadership to kind of exercise getting briefing on a deployment, and then working in Sparta with local businesses that are opening their doors to help us be able to train and not have to necessarily use tents. So church has donated their auditorium or their gymnasium to us to use for the weekend, so that we're in a fixed structure versus a tent for the entire weekend. So other than that, we're just planning down the road for NASCAR and all the other events we've got coming up this summer.
Yes, again, probably another busy summer for Remert. So, okay. Thanks, Mike. Any questions for Mike? And as always, I'll state it every time we get a chance. If you're looking for a volunteer opportunity, Remert is the place to go. You don't always have to have a medical certification or license to be a part of something that's really great for our community. So please volunteer if you are looking to get involved. All right, I'm going to move over to our FY25 project submissions. Just a quick review of what we received last year and what we're going to have on the table this year. 10 organizations submitted proposals. I think if you had to total them up into individual proposals, it's probably somewhere around 16 or 17, similar to last year, roughly around $100,000. Last year we had a much larger bogey for this. For our project proposals, because we had the telemetry set, which we're actually is going through my capital board today, and will be on order here probably by the end of the week. And that was $143,000 by itself. So we were somewhere around $250,000 last year with project proposals. This year, right at $100K. Anderson looking at some decon supplies. Mostly that's what you'll see through here: decon supplies and travel, a few pod or point of dispensing courses and supplies and equipment across the region. But we are moving down the right path to make sure that we are, again, fortifying our response capabilities here across the region. So the next window will open up 1 July, and that'll go through to 15 November. So, and that will be for FY26. And that'll be BP2. So if you have something on your mind that you'd like to take advantage of using your tax dollars, please put together a project proposal for approval. I don't see these having any issues with being approved. One thing I will note, so for my folks out of Bond County, maybe it was doubled, but look like you may have 2 line items. Maybe this is supposed to be around 25K. Just keep in mind that project submissions will be limited to less 25K or less because of how the in-kind contributions are calculated once we exceed 25K. So, but it looked like folks over at Bond maybe had something duplicated in there. So, but we'll be in touch to make sure that everything is right there. Any questions with regard to project proposals?
Yeah, this is Molly from Green.
Yes.
Do we have information on past year signature and proposals that were submitted from 24?
As far as yours being approved, or are you talking about from?
It's just we haven't had signature to complete. So we haven't even spent that fund for our proposal. We just need signatures and that completion. So
Yeah, so the one, I'm just looking at the one that you sent back, the one signed, was that on the 13th? Is that right?
of February.
Yeah.
Yeah.
Yeah, so I did speak with GMO yesterday, and again, unfortunately, they've had some transitions over at GMO. Some of you guys may be unaware of that, but there are some transitions there. We had some folks retire, some folks move on from positions, so they're not in disarray. That's not the right word, but They are a little bit stressed to the gills. So some paperwork is being delayed. I'm going to double back. I thought I saw something else with your guys that Lisa sent back for Greene County, but
Yeah, I think we corrected it now, so all
okay.
paperwork should be right.
Okay.
But yeah, like we haven't spent, and I guess we could go ahead and spend, but we just prefer
Yeah.
to wait for the signature. So
Yeah, I will say this: you can spend, you just couldn't request for reimbursement yet. So I would go ahead and get whatever you guys, so you're not pushing it. I would start, but I will follow up following this with Lisa today and see if I can get an ETA on just having the full package back to you guys.
Yeah, this is Wendy with Bond County. The last message I got from Lisa, they were shooting for February 23 or February 23rd, I'm sorry, for signature, and that is come and gone. And she did mention that there's been a lot of shakeup over there. So yeah, I'm like Molly, we're still kind of awaiting signature before we can submit our invoices.
No, totally understand. And yeah, and again, I apologize. Some things happen sometimes and kind of put some, I hope, I think we're still early enough that no one's behind the 8 ball to be able to spend, but definitely wish we could have, started spending in January like we kind of were targeting. So again, I'll try to get you guys an update today. All right, just really quickly with upcoming events, next coalition meetings on the 3rd of April. We do have the search management course going on this weekend. That'll be great. The eclipse is on the 8th. So all the stuff that's going on, especially a little further down south. And as to Beth's points, hopefully you guys aren't seeing a lot of folks with eye injuries or injuries by proxy of looking up at the sun, tripping and falling. And we had several of those, several years ago. I had a woman fall down 2 flights of stairs. I don't know how she made the turn, but she fell down 2 flights of stairs. Came here to our ER. So please, please, please be careful out there. Buy from approved vendors, as Beth recommended. As you can see, the decon courses we got, and we do have some more on the books, just a little further out. Just didn't want to add them to here. So if you want to host a decon course, please let Lee know. We are getting filled up to the end of the year, so we want to get folks situated there. Again, you see here, I have the Mercy exercise scheduled right now for 10 July. So that is the week following our traditional monthly meeting. So the meeting is scheduled on the 3rd. So I'm pushing to probably make our meeting / Mercy exercise on the 10th. That way people can enjoy the holiday and come back, tan with all 10 fingers and 10 toes from the fireworks displays out there. Does anybody have any real objections to that? Moving both the meeting and the Mercy to the 10th? Hey, hearing none. That was a good 6 Mississippis there. I did see something pop up in the chat. Let me double check while I'm here. Okay, I see you, Wendy. Thank you. And again, project submissions are opening on 1 July, and they will close out November 15th. So if you got project proposals, start dreaming them up now. Looking forward, you make sure you're looking forward, because these are FY26. As you know, we're like 18 months always ahead of time with regard to those project proposals. So you got to kind of look at your crystal ball and do some good strategic planning when putting something together. All right, I'm going to pause there, open up the floor for any questions, concerns before we get into our special guest presentation. Eric, go ahead.
Thanks, Phil. A couple of things on our end. We are still trying to look at putting together an FCC tabletop. I know we ran the full scale last year, but we do have, the VA has a certain timetable for events that need to happen over like a 5-year cycle. We're condensing it down to 3. So I will get that out to the coalitions as well as through STARS, working with Sam because I know she's trying to get all the exercises and big events that are happening over the summer, so we can get that on everybody's calendar. We're still just trying to iron out a time frame, and I believe if we do the tabletop, it will still be at the St. Louis Regional Downtown Airport in Cahokia Heights. The other thing is I'm still working with all the coalitions on their NDMS MOAs. So if you are one of those participating facilities and you are an NDMS partner and you want to update your information and get that over to us so we can get our new, our medical center director to approve those so we can get you in the system, that would be greatly appreciated. Outside of that, that's all I got, Phil. Thank you.
Thank you, Eric. And for those, when you hear FCC, if you're not in the VA world or know what NDMS is, or it's the Federal Coordinating Center, not the Federal Communications Commission. Just in case he was doing a radio check, this will be actually us establishing or enacting NDMS. And that's National Disaster Medical System. Sometimes I just want to make sure everybody knows what we're talking about when we say FCC. All right. Any questions for Eric? Okay, hearing none, we will move over into our guest speaker today and presenter. Good. I'm going to say he's becoming almost a friend of mine. I see him annually at all of our conferences. So, Colby, if you're on, please jump on and speak up. I'll let you fully introduce yourself. I probably can't do it full justice, but Colby is great guy out of GER, and those folks are doing amazing things. So I'm going to allow him to about 25-30 minutes of our time before he has to bounce out of here to provide a good overview on a new software suite here. You tell me when to click the slide and I'll go. Thanks, Cole.
Yeah, I can also pull up the slides if you want. If you want to give me permission to share, and then
okay.
I'll say next for you.
Okay, sure. Yeah. If give me one quick second.
Okay.
Yeah, made you a presenter. You're good to go whenever you're ready.
Yeah, perfect. Yeah, let me. Okay, let's do that right there. Share. And okay, can everybody see the slide now? Yep, you see it?
Yep.
Perfect. All right. So yeah, I'm going to try to be brief here. I've just really given a high level overview, and then if there's any desire by anybody individually or as a group to see anything in more detail, I'd be more than happy to set up other sessions to dive into things. As Phil said, my name is Colby Farrow. I'm the Director of Business Development for Global Emergency Response. I've been meeting with Phil, seeing him at all these conferences around the country for many years now. And when I saw him last few months ago, let him know about a new software solution that we have. And this is really focused around medical charting and documentation. Just a couple of slides. GER, we've been around since 2003. We're located in Augusta, Georgia. I'm in Nashville, Tennessee. And we focus on software solutions for healthcare coalitions, state government, public health, federal partners, really just anything related to emergency response and disaster response. We have folks using our systems across the country, statewide installations with, like, say, the state of Georgia, state of North Dakota, and then lots of regional installations as well. Just real quick, you may have seen some of these things if you've met me before at some of the conferences or heard about our System HC standard. These are just some select modules that we do, like patient tracking, patient placement, mass fatality, contact tracing, facility alerts, and so forth. But what I'm going to focus on today is the electronic medical record, which is called our HC Health Chart. All right, so with that, and I provided also this slide. This is just our main office number and then my email address here for anybody that would like to get any additional information. All right, so you should now be seeing the health chart system on my screen. And so what this is a lightweight EMR. There's really 3 different use case scenarios with this system. I'm really just going to focus on one today. But the 3 scenarios is for smaller facilities for their EMR. Another scenario is for having a EHR downtime backup system. So essentially when the EHRs go down in a larger facility, of being able to continue charting through our system, and then all that data is automatically transmitted back into the existing EHR to where they're able to continue with that encounter, with that charting for the patient. But the one I'm focusing on more today is being used out in the field, being able to stand something up quickly and have it for alternate care site type of usage. So the system being a web-based system, it's easily able to be pulled up, whether it's through a computer, whether it's through a tablet or a cellular device. The user administration and access, it's very quick and simple to give the users who are working at that ACS site at that time access. And then it also has the capability of being able to work in offline environments. So once you actually get the system loaded, which, like, for example, right now I have it loaded, now we can essentially kill the internet connection and you can continue to chart as many patient records that you want. And then once you regain a connection, it will then send all of that data into the database. The screen that we're looking at right now is representative of patients that we currently have active where charts have not been submitted. And one of the things just to keep in mind is we allow a lot of configuration as to how the data is displayed. Like right now, I have it separated out with these different categories, but those are things that are configurable. We also provide notifications on this screen as to potential orders that are currently active for patients, medication orders, procedure orders, for example. And then the ability to do quick views of a face sheet to be able to quickly pull up a patient chart. So essentially everything that was put in, and let me go ahead and back up and say everything I am showing here in the system, this is a demo system. There is no real patient information in this system. So you're able to bring up the information of the patient chart, everything that's been done for that patient, whether it's providing medications, vital signs, notes, exams, all of that, and be able to quickly print that or fax that. So if you're now going to be transferring this patient somewhere, or you need to print it out for the patient themselves, you can do that quickly from this home screen. Or same thing, just say print, fax, shareable links, download it, for example. Essentially, with the charting, a patient is going to be registered into the system, and then you're able to put in data. We have quick flows that each one of our clients determines what quick flows do they want in the system to be able to do things. So that's, again, it's all configurable. And then basically all of this data fields that are on the screen are configurable as well. So we're able to assign care team members. We can look to see at what medications have been given, collect information about the patient themselves, collect information about their medical history. So if we're needing to add, a new medical history, being able to gather that and essentially enter it into the system. You'll notice this is a very touchscreen friendly application. So, if we're using this on a smaller form factor, like on a tablet or a phone, it adjusts appropriately so you can use all of those different form factors. We're collecting information about the encounter itself. We're collecting information, you know, like their vitals. We have calculations built in, you know, auto conversions for pounds versus kilograms, inches versus centimeters, automatically calculating things such as BMI. Or if you're going in and doing a set of vitals, automatically calculating MAP, GCS scores, for example. So essentially, whenever you're charting, documenting care, just like an EMR, you're able to work with that patient and put in vitals, see a timeline of everything that's been done with that encounter, add notes. We have the ability to have templates in the system, the ability to bring in data from other parts of the chart, such as, you know, vitals, or if we want to bring in like the patient name or chief complaint, being able to bring that into the notes as well. Being able to do exams, clinical instructions, your SOAP notes, orders. So if we're, you know, needing to do like a prescription, you know, put in what is that medication, what's the dose, the dosage instructions that need to be for that medication order. And I'll show you where that stuff can be printed out. Or, you know, actual interventions where we're providing medications there on site, or doing procedures, for example, to be able to document all of that directly here from the system. This little outcome section. So if we're needing to essentially just, we're trying to discharge them, you know, we've done our information, treated and released, we can put that data into the system, provide notes, and then we have the ability to put whatever forms you want into the application. So if you have a generic discharge type of form, or if you have a transfer forms, like if we're going to be, is a non-emergent transfer form versus emergent transfer form, being able to have those, and you just click on it and it generates that form for you right then and there, that you can now print or download and also save it into the patient chart. Additionally, documents can be uploaded into the chart. All of those forms can also be manually edited. So even though we're going to populate the information onto the form, you can still come in and add additional notes, you know, like to a discharge form or so forth. And just some examples of what some of these forms may look like: a prescription form, medical certificate, emergent transfer, for example. Collecting signatures, so whether it is a refusal of care signature, a HIPAA release signature, and with part of these signatures, you can have where the text will show up as well, and to where they actually are reading that and signing it. And so then you're collecting and having all of that information, including, you know, if it's a patient representative, the date and time of the signature, all that information is being collected. Previous encounters is not really as applicable to the alternate care site use, but if a patient were to show up again, you know, a year later, and they had been put in our system, whenever you go to register that patient, it's going to search in that database and see if there's a match, you know, date of birth, name, social security number. And if there is a match, you'll be able to go into previous encounters and see what had been done with that patient previously. Lastly, this little offline charts component, that's where if we are using this now in an offline environment and I'm putting in 4, 5, 6 patient charts, that's what allows me to jump back and forth between those charts that I have been working on, the patients that I have in my care, while I do not have that active connection. We do have the ability to put in CPGs into the system. This is just our standard set that we include, but again, this is also configurable. We configure a lot of things, such as your medication formularies, your equipment, the procedures, those sort of things are configurable as well. But again, this is a system that is very easy to set up with multiple events. Essentially, the administration, you have the ability to go in and manage the user. So you have a user and you can turn them on or turn them off real quickly. You have the ability to assign different roles, and it's really granular as to what types of roles people have. So somebody may be working, say, I heard you talk about NASCAR race, and might be working in a NASCAR race. They have a role that's just active for that day or those 2 days. And then, yes, they're still a user, but you're taking them out to where they do not have any access into the system afterwards. So it's real quick to manage that. And then there's also a little higher up of managing charts to where, okay, yeah, we had all of the active charts in the system that have not yet been submitted, but maybe we want to go in and look at all of the charts. There's different roles and levels to where people can go in and look at these old charts, print out those charts, or flag them, or do other items with that. Create shareable links, print them out, be able to provide them to the patient or whomever afterwards. All right, so that again, like I said, I was trying to do this, real briefly, respecting your time here today. That's a quick overview. I am open to answering some questions here, but additionally, if anybody wants to do a real deep dive into any of those use case scenarios, I'm happy to speak to people individually or set up other calls as a group.
Awesome. Thank you, Colby. I will pause here for a second to allow folks to ask any questions that they may have. Okay, hearing none, I will ask just one question. I know when we couch this, or when we talk about it, we're talking about our ACS operations, and you brought up the NASCAR, what Mike was talking about earlier. What other configuration do you have? Don't you kind of have a version of this that kind of you can offload to, like, let's say folks who are working on a specific charting, that I'll just say the word Epic because I know a lot of folks use Epic, but where that can be offloaded into what you have now, and then this can pick up, so it could be used for whether it's downtime or a long-term or a longer outage?
Absolutely. So there's a lot of different ways of setting a system up that way, but essentially there is a data transmission language for healthcare data. Everyone's probably heard of HL7. A lot of stuff has moved to this FHIR standard, FHIR. And so we talk with that standard, and that's how interfacing with systems such as Epic or Oracle takes place, to where if that system is not up, it's not active, and we have that connection in place for that facility, basically that instance, then for example, you start registering, you start doing charts in here, then you're collecting the data just like we showed. And then once the EHR comes back online, whether it's Epic, Oracle, whomever, then the data that you put into our system automatically is transmitted and fed and reconciled into that system, so that now you can go back of using the original system, your primary EHR. And so you're not having to rely on any paper charting or going back and trying to timestamp things appropriately with a chart. There are many levels of that. There's levels to where we can do, where essentially if the systems go down, that you're just putting in the patient like you're registering them. You got to put in their name, their date of birth, or it can be set up to where there's actual what we call seeding of the data. So where our system is continuously bringing down information that exists in the EHR. So for example, patients that have been charts that have been open in the past 24 hours or 48 hours, and that data automatically updates, so that if the EHR goes down, when you go to register a new person in our system and you put in that name and date of birth, if it exists in your EHR over the past day or two, then it'll pull down the information as to essentially what's their medical history, so that you have, like, what were their allergies, what's their previous diagnosis, and that sort of stuff. So there are lots of ways to get that set up. But yeah, that is another use case outside of the ACS configuration.
Awesome, awesome. So for the folks again who are online, I know recently our partners outside in HSHS here in the region had a long-term downtime operations where they did not have access to a lot of their network infrastructure, but obviously charting on what service that they use, that creates a big disruption and is a time suck for a lot of folks who've ever gone through that. We here at Memorial, we had this happen to us in 2014, and they were down for 3.5 weeks, and that completely, I won't say crippled Memorial, but it took a lot. It was a Herculean effort. So for anybody who had to do that and make sure they're routing labs and all that type of stuff the appropriate way by hand, it takes a lot. So this can help in those operational and recovery side portion of that type of response. So I would again encourage folks that if this is something that they're looking at using or incorporating their sides, that maybe you may want to reach out to Colby to have a more in-depth presentation. We are looking to add this as a component to REMERT. For those of you who recall, we primarily use EMTrack during a lot of those responses, whether it's the belt or special events, not responses, whether it's the Belleville Marathon or NASCAR, and it's probably not built the right way for what we're doing. So we are looking to try to move over to this to assist with those type of specialized events, special event planning, and patient treatment. And then in the case where we're doing alternate care site, or we have critical access hospital that fully goes down and we need to help move in and move patients and get patient records, all that type of stuff, using this in those regards with REMERT as well. So again, here's Colby's information on the screen. I'll leave it up here for you guys to either capture. Obviously, you guys should have a copy of it in the presentation that I sent out yesterday, but feel free to reach out. So any last parting thoughts, Colby? Anything?
No, that's all I have. I appreciate it, Phil. Thanks everybody for the time and opportunity to show this to you today.
Oh no, thank you, Colby. I appreciate your time. And if I don't see you sooner, I definitely will probably see you at IAM or NACP sometime later this year. So
great. Thanks everybody.
All right. Thanks, Colby. All right. And for the rest of us, as a coalition, this basically concludes our meeting. I'll give our folks an opportunity, any alibis, questions, concerns, things they'd like to bring up to the group before departing.
Hey, Phillips Lee.
Hey.
One last pass on PPE, folks. We want to empty this warehouse of stuff that is otherwise going to go away. So please, if you have need for gowns, gloves, masks, face shields, all that, let us know. We'll happily meet you there to give you as much as you can carry away.
Indeed, this is the first step in us in part of that cash assessment and mission ready packages / just realignment for how we are storing and utilizing the medical supplies and equipment that we have across the region. So if you need something, we hate for some of the stuff to just go away, get 86'd, but we got to make room and we got to be more efficient and effective with what we do have. Tim, I see your hand up. Go ahead.
Yeah, can you hear me, Phil?
Yep, got you loud and clear.
Just wanted to, I don't know if anybody got on from Scott, but we're going to be exercising all next week. So just making everybody, aware. Hopefully they coordinate with Sam and letting her know that during the week, she should be getting, some exercise injects, some phone calls. But I just want to make sure, this group knows.
Got it. Are we doing ORI type exercises, or are we talking mares? What are we doing?
Yeah, so we're trying something really, really different. We're simultaneous. We're gonna try to split the dip base in half. One that the far side of the base will be ORI type, and then the main base will be in Garrison. And we're gonna try to run them at the same time.
Oh, okay, awesome. So for folks that are on, when I say ORI, that's operational readiness inspection. So that's the traditional war games, so to speak. And then the in Garrison side, I guess you'll do a mix of things on that side. But yeah, that should be interesting. I may have to come out there and if I see some folks in some mop gear, maybe that's what I need to go see. Okay. Thanks, Tim, for update.
All right.
Anyone else?
Hey, Phil, it's John Nowak. Since
Yes,
Tim
sir.
brought
Go
that
ahead.
up, I can tell you MedStar will be participating with a couple of the different exercises that are going on out there. And we will be using EM Track, just you know how we do that. But if the hospital receives a patient, because some new leadership out there would like to see how that actually rolls. So any day that I go out there and we're going to actually be a part of the exercise and EM Track will be being used, I will contact you to let you know that it would all be exercised. So if the hospital actually gets a notification that they're receiving a patient, the first name should be exercise and then the name should follow. Just a heads up, because we will be using it.
Copy that. Thank you so much. All right. Well, we're right at the hour. And normally we do these for 2 hours on the quarterlies, but this is great. We're right on time. Give you some time back to your lives. I appreciate everyone out there. Again, if you have any questions, feel free to reach out to us via email. You can always email myself or Lee directly, or you can send it to info@swillhope.org, and that'll hit us all, and we won't miss your question or concern. So thanks, everyone, and we will talk at you next month. Take care.